Hello, my name is Gilberto Cota. I am a hemodialysis patient for the last 8 years. I'm also a family practice physician. I studied medicine in Mexico and then passed my steps in the United States and completed my residency program under UC Davis at Modesto, California. For the last 8 years, I have dialysis and I'm going Monday, Wednesday, and Friday for 4 hours. I decline under my responsibility to get a fistula, and I rather stay with a perm catheter, which I take care a lot because I'm aware this is a big risk I'm taking, and especially the risk of infection. Having a catheter needs a lot of care, and the most important thing I think is to cover properly to avoid further infections. So the reason for this video is to show how I'm taking care of my catheter and hope this information can help you if you have a permanent catheter, so you can take a shower and keep it clean and prevent infections. Again, this is my experience as a patient more than as a physician. As a patient, you learn a lot, and I know every physician will recommend you to have a fistula. My personal experience is I'm doing great with the catheter, but again, under my responsibility, I'm taking extreme care of it. Now, here are the things I'm going to use to cover my catheter. I like these 3M Tegaderm. They are the best to use. They work really good. So this will be like the individual one, and I will need 4 of these plus one of a sterile 4x4, and I will show you how I will use them. So before starting, you will need to wash your hands and use a mouth cover. And usually I wash pretty well my hands for 1 minute if possible. If not, I also sometimes use alcohol at the hemodialysis center. But here at home, I use plain water and soap. And then to dry my hands, I use some kitchen paper towels, especially used for this. So before starting, you have to prepare, and I use the same dressing cover as a sterile drape, so I can use the Tegaderms afterwards. Usually I use 4 of them, 4 of these, and 1 of the 4x4. So the way you open this thing is very important. Try to avoid contaminating the inside. Just put it on the top of the other 3, and I will do the same for the 4x4. I will put it on the top, as this will be the first step. So again, I had my hands clean. After washing my hands, I will proceed to remove. This is a regular dress that they put at dialysis, and as you can see, it's very difficult to take a shower if you want to keep it clean and dry. So I asked them to do this special trick. This 4x4 is very loose, and I used this little like anchor tape, so it won't fall down until I get home. So I'm going to take this to the trash. Then I'm going to use another sterile 4x4 Okay, I'm going to bend it this way, and I'm going to put it like this. So I'm covering the catheter, but I'm not touching the catheter or anything directly. I'm using the 4x4. Then I'm going to proceed to start using the tegaderm. If you see, there is a guide here. So I place all the 4 tegaderms with the same direction, and I'm going to place them like this. The first one is going to go something like maybe kind of 1 inch below and 1 inch every direction. And as you can see, I'm placing them so that let the water run. So the next one will be on top of this one, like 1 centimeter. So I'm placing this on top of the other one. I'm going to remove this. Sometimes it's hard because this thing, the little thing, it's over the catheter, so it's difficult to remove. So I remove this one as well. Now, if you can see, the tier 1 will cover all the catheter and the sterile gas, but I told you I will need 4 because the 4th is just to be extra safe and guarantee that no water will get through. So after I am all covered, I put an extra one just on top of this. And don't worry, if you move your head, your neck, it won't remove or anything. But as you can see, this is extra safe, so no water will come inside of it. So using this mechanism, I am safe, and I know nothing is going to contaminate the catheter or especially the hole here. So it has a very good cover with sterile tegaderm. So it's safe to walk around, to be outside or anything. Just I won't recommend to use it at a pool or at a tube, only for regular shower. That's very safe. Actually, the shower water flow can hit me right here, nothing happens. But I won't recommend to go into a pool, or any place when you're going to submerge under the water, because the pressure can make a way, and then you're going to get a very serious contamination. So after this, it's very safe to remove your face mask and just get your regular life. Thank you very much. Hope this helped you. Please subscribe so I can make more videos and share what I have found about how live better with dialysis. Thank you. See you next time.